This is the story of the Singapore healthcare system. Singapore ranks 6th in the world in healthcare outcomes according to the World Health Organization, yet spends proportionally less on healthcare than any other high-income country. In this presentation, we will be discussing an overview of the system, analysis of the healthcare system, and the health status of the nation. Singapore is an island country located in Southeast Asia, home to over 5.2 million residents. Singapore takes up approximately the same space as the city of Edmonton, Alberta, but houses over 5 times the population. Here you can see Singapore in perspective to its neighboring countries. Moving into the system's overview. Singapore's healthcare philosophy is to ensure quality and affordable basic medical services for all. Their mission is characterized by 3 strategies. The first one is to promote good health and reduce illness by educating the public on how they can maintain a healthy lifestyle. Secondly, ensure access to good and affordable care by ensuring that healthcare in Singapore is characterized by good clinical outcomes and professional standards. And lastly, pursue medical excellence. Core values include dedication, excellence, professionalism, integrity, and teamwork. Their vision for the future is to live well, live long, and with peace of mind. Moving into the historic healthcare roots. Before independence, Singapore was a country of poor incomes and poor health outcomes. Singapore became a fully independent country in August of 1965, but was still challenged by housing shortages and high unemployment rates. Political stability of the country has added to the many successes of Singapore. Since its independence, there has been one party in power, which is the People's Action Party, whose top priority has been population health. The government had realized early on that health conditions were strongly correlated with the overall development of the country, such as access to water, housing, and clean air. Early initiatives were put in place to address these issues of providing sanitation, clean water, development of vaccination programs, and the guarantee to basic health needs for all individuals. In 2011, there was a public concern that the government was not doing enough for the elderly, as well as some families experiencing bankruptcy as a result of paying for healthcare costs of older family members. The government responded by doubling the Ministry of Health's budget over 5 years, as well as increased subsidies for services such as long-term care, home care, nursing homes, rehabilitation, and daycare. These subsidies provided some financial relief for middle-income families. There are 4 main contributing factors to Singapore's successful healthcare system. Singapore's efficient healthcare system can be linked to its early primary healthcare. After Singapore's independence, the government wanted to bring healthcare to the people, so they decentralized it, from an overcrowded general hospital to many outpatient dispensaries. This movement to outpatient clinics was a critical factor in the transformation of Singapore's healthcare system. In the 1980s, a push for medical specialization called the Healthcare Manpower Development Program was launched. It gave specialists opportunities to train at world-renowned medical institutes overseas. This action nurtured a new generation of highly skilled specialists. In 1983, the government promoted a national health plan that explained the idea of Medisave. This has also been noted as a cornerstone of the current system. And restructuring of the public sector hospitals involved merging with business and financial disciplines, also contributing to higher quality services. Lastly, in 1990, as healthcare costs started to grow, the white paper entitled Affordable Healthcare was released. It was a blueprint for Singapore's current funding strategies. Major stakeholders in the Singapore health system include the public. They have a compulsory savings account known as Medisave that allows them to pay for much of their own healthcare and are the end user of the healthcare system. The government. They set contribution rates for their workers and other employers as a percentage of their wage to contribute to the Central Provident Fund, Medisave being a component of this. Thirdly, The Ministry of Health is responsible for Singapore's healthcare through the regulation of the public and private sectors. As well, strong regulatory bodies and regulations are in place to make sure that high standards are maintained. Lastly, insurance companies are also major stakeholders in Singapore's healthcare system. Next, we will move into the analysis of the healthcare system. Singapore's healthcare system is a mixture of public and private sectors. Although BAME does not explicitly discuss Singapore in their article, we suspect that Singapore would fit under an Etatis social health insurance system, as it is regulated by the state, financed by society, and the majority of services are provided privately. Singapore spends less than 4% of GDP on healthcare versus Canada, who spends approximately 11.2%. Singapore uses a system called the 3M system to fund healthcare. It consists of MediSave, MediShield, MediFund, and more recently ElderShield. Private insurers also help make up a portion of financing in Singapore. MediSave is a national insurance in which citizens of Singapore build a savings account for future healthcare needs. The savings can pay for hospitalization, outpatient treatments, MediShield premiums, and private medical insurance schemes. Monthly contribution to MediSave accounts is mandatory and based on retained ranging from 7% to 9% of monthly salaries. The annual withdrawal amount from each Singaporean is around $732 on average. MediShield is a complementary service to MediSave. It is a medical insurance that allows individuals to settle part of the expenses from outpatient treatments for serious illness and prolonged hospitalization. This graph lays out the yearly premiums of MediShield based on age. It shows the difference in payments the older an individual gets. Someone who is under 30 years of age would only pay about $33, while someone between the ages of 84 and 85 would pay around $1,123. MediShield does not cover any individual over the age of 85. Singaporeans are able to choose to use MediShield as their health insurer, or they can choose to use another private health insurer. MediFund is an endowment fund set up by the government for individuals whose MediSave and MediShield are not adequate enough to cover hospital expenses. MediFund is added when there is a surplus in the healthcare budget. The total amount of MediFund was $1.3 billion by the end of 2010. Amounts that a patient can claim depends on their social and financial circumstances. ElderShield is the newest addition into the 3M system. It is an affordable insurance for severe illness and disability which provides basic financial protection for elders. ElderShield recently expanded its funds to a larger amount of $400 over an extended period of time for out-of-pocket expenses. The Ministry of Health has appointed 3 private insurers to run ElderShield. Citizens who are enrolled in MediSave are automatically covered under ElderShield when they turn 40. Premiums are paid annually until members are at the age of 65. Private finance. There are 5 private insurers in Singapore that offer private plans for both individuals and groups. Plans cover similar expenses due to inpatient and outpatient medical expenses, surgical costs, critical illness, disability, and long-term care. The 2 types of plans that are offered are the Private Medical Insurance Scheme, also known as PMIS, and non-PMIS. Next, we'll discuss regulatory bodies. The state regulates the public and private providers by requiring them to purchase a license. Within Singapore's healthcare system, there are 3 main regulators. The first and largest regulatory body is the Ministry of Health. The Ministry of Health oversees the provisions and regulation of healthcare services. Specifically, it is in charge of promoting health education, preventing and controlling disease, allocating resources, monitoring accessibility and quality of healthcare services, and administering license. In order to obtain this license, Healthcare facilities must adhere to Ministry of Health laws and guidelines, which gives the MOH a lot of authority in Singapore's healthcare system. The Ministry of Health also creates legislative acts that all healthcare providers must practice under, which allows it to further regulate many areas of healthcare within Singapore. There are a few different areas listed here. The Health Sciences Authority operates under the Ministry of Health and has three main functions. It is the national regulator for health products. It creates blood supply for the nation through its operation of the National Blood Bank, and it represents expertise in forensics and analytical testing capabilities. The final regulator is the Monetary Authority of Singapore, which is Singapore's central bank. It regulates the financial aspect of the insurance sector. The MAS administers the Insurance Act, which protects policyholders and regulates insurers' activities, including registration and licensing requirements. In Singapore, all healthcare professionals are self-regulated under one of the following professional bodies. Now on to organization of health services and delivery. Singapore's healthcare structure functions as a primary healthcare system, supplying its residents with primary, hospital, long-term, and other integrated care services. Here's a pie chart showing the healthcare services provided in Singapore. 80% of the care is supplied by private practitioners, while the other 20% is publicly delivered. 80% of hospital services are publicly funded and 20% is privately funded. In-hospital services include inpatient, outpatient, and emergency care. In the year of 2014, there were 11,230 hospital beds available in a total of 26 healthcare facilities. Hospital services in Singapore are divided into 5 tiers. Tier A gets you a private room, private bathroom, AC, and your choice of doctor, but the patient pays for everything. If you choose C, you get an open ward with 7 or 8 beds, shared bathroom, and an assigned doctor, but the government covers up to 80% of the cost. The B tiers, they range in between these two. There is a wide array of polyclinics and private medical clinics that provide patients with medical treatments, upstream programs, and education. 80% of these services are privately funded on a fee-for-service basis, while the other 20% are publicly funded. The Ministry of Health has recently reconstructed the healthcare system to provide patients with more holistic and integrated care. As you can see, the country is split into 6 regional healthcare systems, called clusters, each containing a regional hospital and a variety of primary, intermediate, and long-term care services. Now we will discuss the health status of Singaporeans. Some of the healthcare concerns of the population in Singapore include the aging population, management of chronic disease, and communicable disease control. It is estimated that by 2030, 20% of the population will be over 65. Like many other countries, Singapore's healthcare system faces the barrier of being unprepared to sustain this population. Overall age is increasing as a result of increased life expectancy and declining fertility rates. There is a shift from episodic care to long-term care, treatment of chronic disease, and community disease prevention. Researchers have shown that this is a necessary shift in Singapore to combat the issues associated with their aging population. Some of the most prevalent chronic illnesses that impact Singapore include asthma, COPD, diabetes, hypertension, high cholesterol, and stroke. These illnesses largely affect the lives of individual citizens, but also the Singaporean society as a whole. These diseases have an influence on individual quality of life and contribute to financial difficulties experienced on a personal and national level. Like many other developing countries, obesity and diabetes are increasing at correlational rates. In 2010, Approximately 11% of Singapore citizens were living with a diagnosis of diabetes. The rate of diabetes among Singaporeans increased by 3% between 2004 and 2010. Communicable diseases are a national concern in Singapore. The SARS outbreak in 2003 demonstrated the need for infection control in Singapore. Approximately 200 reportable cases of chikungunya, which is a mosquito-borne infection, arose in 2008. This prompted further precautionary measures due to the impending possibility of an outbreak. The Ministry of Health is continually ensuring medical providers are prepared for an influenza pandemic by practicing mock drills and exercises. Dengue fever is an endemic in Singapore, for which the focus of treatment is aimed at vector control. Singapore produces world-class outcomes on par with the most developed nations of the world, but it does so at a fraction of the cost usually associated with high-quality care. Singapore has achieved noteworthy outcomes in all areas of healthcare. The life expectancy for women is 84 and for men is 79. The infant mortality rate is 2 in 1,000 live births annually. The under 5 mortality rate of 3 male deaths and 2 female deaths in 2,000 live births is one of the lowest rates worldwide. Additionally, childhood disease have decreased as a result of the National Childhood Immunization Program. When compared to the rest of Southeast Asia, the adult mortality rate in Singapore is much lower, with 60 deaths per 1,000 each year. So how is Singapore achieving these amazing results? The Ministry of Health assesses patient satisfaction through regular surveys. In 2010, over 75% of patients reported being satisfied with healthcare services, while 80% would recommend the services of public healthcare institutions to others. An example of the government's responsiveness in meeting the healthcare needs of the population pertains to support of the elderly. When the government became aware of the increased need for services supporting the elderly, the Ministry of Health's budget was doubled to address the concerns of Singaporeans. The government increased financial support for subsidizing caregivers, long-term care, nursing homes, daycare, rehabilitation care, and home care. Barriers to service provision. These include the aging population, lack of services for elderly people living in poverty, and lack of staffing. Again, we see this aging population as an issue for Singapore. This time, the issue is in regards to service delivery, instead of population health concerns as previously discussed. There has been increasing concern about affordability and accessibility of services for the elderly population. In recent years, the government of Singapore has taken a unique approach to addressing the aging population by engaging a wide variety of government ministries, including finance, transportation, housing, social welfare, healthcare, wellness, and many more. The government intends to expand elder care facilities, such as nursing homes and senior activity centers, and integrate these facilities into all neighborhoods. After a patient is discharged from the hospital, his or her quality of care tends to decrease. Organizations such as the Agency for Integrated Care hope to overcome this barrier by ensuring all patients receive care in the community after being discharged from the hospital. Singapore hopes to transform the healthcare system, so acute general hospitals will be linked to community rehabilitation hospitals and will be supported by groups of primary care providers and community organizations. Another barrier is lack of manpower. Currently in Singapore, there is a shortage of nurses and specialists. To try and minimize the nursing shortage, Singapore has been actively recruiting nurses from overseas. To try and minimize the shortage of specialists in Singapore, they have added more recognized schools, adding 39 schools in 2007. With the shortage of these professions, it may be difficult to initiate healthcare shifts. Today, Singapore ranks 6th in the world in healthcare outcomes, well ahead of many developed countries, including the United States and Canada. The results are all the more significant as it spends less on healthcare than any other high-income country. Overall, Singapore appears to be providing exceptional healthcare services to their entire population through a variety of delivery methods. Thank you for watching our presentation. We look forward to hearing your comments and engaging in discussion about the Singaporean healthcare system.